right. Barfly Nation, barflies worldwide. It's a great day. It's a great day to be a respiratory therapist. Super excited. We get to kick off our fresh new look with Moaz today. Moaz, we're super excited to have you. As always, the Mindy Conklin and JJ the RT are with me as co-hosts to talk about something really interesting. We have been thinking about this for a while. We talked about our last episode. We need to champion the work that we do. We need to empower each other to be better than we were the previous day. And we need to show our influence. So to really kind of put a big package around this is we have Moaz Mohammed from Egypt coming to visit RT Sidebar. Yay! We're very excited to have you, Moaz. I got a chance to meet you at AARC. You're like, hey, I know you. I'm like, hey, I know you. This is how it works. So recently we had some friends in the UK and they don't have respiratory therapists. We talked about it little back and forth on social media, but they don't have respiratory therapists. They have respiratory physios. And about 5-6 years ago, Egypt didn't have respiratory therapists. So I'm so super excited to talk to you. I have to give a shout out to all of your titles that you have because like you are kicking butt there in Egypt. You are the founder and CEO of Respiratory Gate Egypt, which is basically like a meeting house of all respiratory therapists, and then you distribute them around the country, which is awesome. You're the governor for the International Council on Respiratory Care for Egypt. You're the vice president of the African Respiratory Care Association and an international fellow of the AARC in 2023. So for all us barflies, all my hosts, Moaz, we welcome you.
Thank you very much, Matt. Thank you very much.
We're so excited. So not that long ago, not any respiratory therapist. How on planet Earth did you become a respiratory therapist?
Yeah. So first of all, thank you very much, Matt. Thank you, JJ. Thank you, Mandy. Thank you for having me in this podcast. And I'm very glad to be here with you today. And it's actually the first time to be in the podcast. So just bear with me here. Yeah. So I'm gonna tell you, it's like not a short story. However, it's a short story, and it all goes back in 2012 when the Applied Medical Science Faculty of Applied Medical Sciences here in Egypt, in one of the universities in Cairo, have decided, okay, we're gonna build a department called respiratory therapist. I think like it was the dean. She was working in the US and she went back home and said, okay, I'm gonna respiratory here in Egypt. So what she did, she would just prod all the textbooks and everything. And okay, guys, let's do respiratory. Funny enough, no regulations, no faculty, nothing, like nothing. Just okay, let's start it. So, and I think it was the first batch. It was like 4 persons, like 4 individuals, and then we had 7 individuals in the second year, and it was like all these numbers less than 10 joining the department in our faculty. So, okay, so we started. Our first year, we have only bachelor's degree in Egypt. We don't have associate's degrees such as the US. So it's only a bachelor's degree. So it's a 4 years program, and then you followed up with an internship year. And this internship year is like a training year in different settings and institutions and so forth. So we started, okay, I was the one of the first batches. So we graduated, and then I think it was in 2017 when the first group of us, which were 4, joined a hospital, the one I'm working at now, the Air Force Specialized Hospital. Shout out to the Air Force Specialized Hospital as well.
There you
She was
go.
the first in a institution, yeah, to let's say okay, we started this program there. We started working. It was the first institution that implemented the respiratory practice in their things and in the medical practice. So I think we met one of the consultants, the ICU consultants, of which he used to work with the respiratory in Saudi, I think, or it was one of the Gulf of countries. And then when he heard that, okay, we have respiratory in Egypt. Okay, I'm taking you out with me to the Air Force Specialized Hospital. So we started there. It was 2017, and believe me, it wasn't good. doesn't go whatsoever. So imagine, yeah, because yeah, it was 4 years of taking curriculum. The first time you take your egans, you
Yeah.
have it in
Yeah.
your hands. Yeah, yeah, this is our profession. We loved it. Okay, what is that? No one teaches what's in there.
No.
It's only physicians, only ICU physicians, only anesthesiologists, only people who has a medical degree who teaches us what's in there with the perspective of the physicians.
Yeah.
And I think this was the point, because okay, so we get back to the hospital. Okay, let's start this. What are we gonna do? 4 years of teaching on taking materials that we don't have any perspective of a respiratory. I think this was the time I reached out to people in the US,
Okay.
because I there's a chapter in Egan's. It's just it talks about the structure of the department and everything. And
Hmm.
okay, all right, there's an MPRC, a co-arc, an ARC, an ICRC. What the hell is that? Sorry for the wording. You know, so the thing is that okay, we went back to the hospital, and after 4 years, as I mentioned, 4 years of training and 4 years of educational material. Yes, it has the RT things. However, no one teaches us how an RT should approach this or have a protocol about respiratory. Everything is about ICU physicians, how to manage the mechanical ventilator from a perspective of an ICU physician, because every ICU physician has its own perspective. However, they weren't as we were taught, because we had this material. The educative material is like very RT specific. And I remember one of the classes I went to, it was about the gases, as far as I remember. And the physician just said, okay, guys, this was the first time I read about this. It was yesterday, and I'm going to teach it to you. Yeah. And it was about I think the conversion factor for the cylinders, the oxygen cylinders and
Hmm.
everything. So I remember this very well, because right now when I teach about the cylinders, I just tell this story. Because imagine that you are being taught by someone. I shout out that this person, he was very, very keen on educating us. However, he didn't know about the conversion factor of a cylinder. What are we
J-
doing? Like,
JJ, you teach like this.
Moaz, like your first few weeks at the hospital sounds like my first few weeks of teaching. Like I just read this last night, but we're gonna get after it today.
And
yes,
it's very similar to me.
yes,
I jumped into a role that hadn't existed before. No RT had become an APRT before, and I jumped in. I'm like, okay, where do I go
Hmm.
from here? There's really no one to show me how to build it. So you build it from scratch. And when you build it from scratch and you work hard, it grows and evolves. So
I,
exactly.
I just
So
can't
I
imagine
think
the fear you had. You had to
Mhm.
have. You're walking in there and you just like
Funny
now
story.
what?
I'm gonna tell you. The consultant that included us in the hospital, he thought that we were working RT, not just new graduates RTs. So
Oh.
we should, okay, we went there and we started working, and we should fake it till we make it, guys. We should know what we're doing, because if we know what we're doing, they do it. Okay, are you still you're new grads? Yes, we are new grads. Yes. So I think we started, and then it goes with the flow. We start working there. And I remember it was in 2019, I think, when
Mhm.
we first introduced the high flow nasal cannula to our institution. And it was the first time to be like an actual high flow nasal cannula. And they didn't know that. They thought that we need to buy a new device.
Mhm.
However, we are a 75 ICU beds hospital. It's a big one.
That's
And
pretty
I think
big.
it's one of the biggest here in Europe. Yeah, it's big, and they are building an extension now, and maybe we're going to 150 very soon. So it's a big hospital. So imagine we have like more than 60 mechanical ventilators, different mechanical ventilators,
Hmm.
draggers, McKays, everything. We have everything. However, okay, we know these devices, and we know that there is something called oxygen therapy included in the device. So, and it has a flow and oxygen. All right, so maybe this is the high flow nasal cannula. So we just put the button and okay, this is the high flow nasal cannula. So guys, we're not gonna tell them that this is a newly discovered for us. We're gonna tell them you don't know that you have high flow nasal cannula in your institution. So okay, so this is what actually happened. So we went to them. Okay, we just need the tool. We need the kit, the high flow
Yeah.
nasal cannulate, the cannulates. So I remember we had like 1,000 piece in our hospital, and we started using it. And I think it was in at the end of 2019 when COVID started. We started seeing patients with COVID. It was the
Mhm.
end of yes, it was the end of 2019. And I remember this patient because I remember the bed this patient like stayed. And it was a patient came out from, I think, Libya or from another country. And he has this, and he was an ARDS patient, and he has all the manifestations of a, he wasn't good. He wasn't doing good. So I think we treated him as H1N1. And because we didn't know that there's something
Didn't
called
know.
COVID.
Mm-hmm.
Yeah, we didn't have the PCR, everything. It was just newly thing we heard in the news. So I think this patient has passed away, and I caught COVID from this patient. I didn't know that I had because I stayed 2 weeks at home, and I was dying. 2 weeks it
Oh,
was
Oh
hard. I
no.
was
yeah.
feverish and everything. Yeah, and I didn't know I had that. I just having my antibiotics and everything, and
Sure.
the symptoms goes up and down, and I just eventually I was good. So then at the beginning of 2020, I think it was
Mm-hmm.
like in February, I think, this when we are gonna have this isolation ICU in the hospital because
Mm-hmm.
we start getting the kids, patient to start being positive for PCR, positive for COVID. Okay, I think we were 7 RTs hired at this hospital back then in these days. We were seven,
7.
7 or 8 working. Yeah, yeah. And we were, as I'm telling you, we were. It's a 75 ICU bed.
Yeah.
So we work 24-hour shifts,
Oh,
and
wow.
it's not 12 hours; it's 24 hours. Yeah. And imagine having one of the ICUs. It was like 30 beds or 25 beds, and only run by one RT. Just we are 100 million population in Egypt, and
Mhm.
only 7 RTs. Imagine that. So this was big. This was big. So I think they called me out because they need me in one of the hospital. They need me to check. And imagine that the high flow nasal cannula I'm talking about is the one that made them okay contact this person to see if our devices has the high flow nasal cannula. Not we need you to just to manage those people or anything.
Mhm.
No, just we need you to check. So we went there. It was me and one of my colleagues. Shout out to him. His name is Muhammad Tamim. So yeah, we start taking over the ICU. And okay, they said, all right, so you're staying with us. You're not leaving. And it was like a military order or something. So so we just stayed there. Yeah. We were forced to stay there. They said, okay, your main hospital is gonna pay your salary, but you're staying with us. So we
Holy
stayed
cow.
there for yeah, we start having this curfew, all the country is like closed, nothing. So I said, all right, I'm not going home. I don't know what I'm going to take home with me, my
Yeah.
family and everything. I'm
Mhm.
staying at the hospital. Stayed for 45 days consecutively.
Oh, wow.
So I didn't leave. Yeah, we just stayed there. We have our rooms and everything. So I just stayed there.
Hmm.
So
COVID ended up being the equalizer, to be honest. Your stories sound exactly like our stories when it came to COVID. Is the only difference is your profession was in its infancy at the time, right? But what ended up happening is we have been who have been doing this for a while and in a profession that's been around in the United States, we went back to our infancy as well. We didn't know what to do. We figured out months in that high flow worked well. Keeping patients off ventilators worked well. We all kind of learned it in our own little bubble but I could see like one of the things that I was proud of is the recognition that respiratory therapists got during COVID. You're 7 out of 100 million. Like nobody, the majority, 99% of your country didn't know what a respiratory therapist was. I bet you now they do. I just, it
Yeah,
feels,
yeah, kind of. It comes with the story. I'm not, it comes with the story. So what happened after that is I think it was in 2023. It was the
okay.
start of 2023, and I found this on the media, the fellowship, the international fellowship with the
Yep.
ARC.
Hmm.
Yeah, and I found this, and I figured out why not should I apply? Okay, no, you're not going to be accepted in this or so. So I saw it at the beginning of the year,
Hmm.
and I think I applied on the deadline. I think it was the same day the deadline. It goes. I think it was April,
Hmm.
and I applied. Okay, I'm gonna send this. And funny story is, they ask you for recommendation letters and people you worked with and everything and physicians you
Hmm.
worked with. I remember I brought these things and I went to the consultants and everything. Okay, I need you to do this to me. And they just said, okay, okay.
Oh.
So I did it. Yeah, so I took this and I sent them to I think it's the American Foundation for Respiratory Care, the
Hmm.
AFRC.
Hmm.
I sent it to them and I just figured out someone contacted me. Hello, Moaz. I got accepted in something related to my profession, and it's gonna be the very first time I hear about my profession from someone in the profession. And I remember, and I received this email, and congratulations, you've been accepted to the International Fellowship in US. And we need you to provide this and this and this. It's just the normal emails. And I was, all right, oh my, okay, there is a lot of things to do. There is a US visa, and there is a lot of things.
Hmm.
And this is hard to get. Believe me, nothing has a single obstacle. It was just going like this, everything is going like, all right, I'm going to the US. So
It
I
was meant to
received
be.
my email. Yeah, I got my visa, and I think it was in October. I think it was last year, 2023, October
23. Hmm.
2023. And yeah, I remember this because my birthday at the end of October, and I have the very first birthday in the US. So knowing
Oh,
about respiratory
nice.
therapy, yeah, I arrived to the US to Washington D.C. and I met with Carolyn Williams, Miss Carolyn Williams. I bet you know her, and
Hmm.
she is like a huge advocate for the profession. And
Hmm.
I met her, and I funny story, I lost my luggage at the airport.
Oh.
You should have a story when you reach the airport internationally. So, so I lost my luggage, and we stayed like I arrived. It was 3 o'clock, and we stayed together for like 9 p.m. because I lost
Mm.
the luggage. We went back to the airport, and we this was the very first day in the U.S. So I started that. It was the 21st of October 2023, and my
Mhm.
birthday was the 25th. So I think I had my birthday at Medster George Washington Hospital, and
Oh,
I had
there you go.
what's his name? I know someone from there.
It's
Eric.
either Eric
Eric.
Kreiner was
Eric.
there, right?
Right. Yeah.
And then
Yes.
I believe Fassel's there as well. That's your territory,
I
Mindy, down in DC,
Yes,
Maryland.
I, I, I remember Eric. I remember Eric. We talked together, and okay,
He's got a
so
good hair. He's got a good haircut like I do.
yes, it's yours. So Eric was the first person to teach me about respiratory. So shout out to Eric from here.
Hmm.
So because yeah, he told me you need to do this and to need to do this and this and to read from this. And he has like this kind of program they provide to the fellows in the ICU and everything. So this was the first time to learn about respiratory after 5 years of practicing respiratory.
Hmm.
Imagine that. So, okay, 2023 was the start. So I went to Washington, D.C. Then I went to Kansas. So this was Karen Shell, and Karen Shell,
Mm-hmm.
she was amazing,
Mm-hmm.
amazing. And I think the one take home message from Kansas was what was it? They have a center, a rehabilitation center for the ALS patients. And okay,
Mm-hmm.
you have a full center for ALS patients, a full center for ALS, and they having all the staff were RTs. Okay,
Mm-hmm.
just like a neurosurgeon or someone else and all RTs. Okay, this profession is big. And I remember one of the hospitals they were having 40 or 80 RTs on shift on duty, and we have four guys. We have seven
Yeah.
in the whole country. You have 40 on the shift. You have 40 on the shift.
Mm-hmm.
This was big, and Washington was good. Kansas was good, and then I went to Tennessee when I met Mandy there in Tennessee. We have a very good
Mm-hmm.
picture, of Mandy there.
Yeah.
Remember it?
I remember. I
Yeah,
still have it.
yeah. We met there in Tennessee, and okay, the ARC Congress. Oh my!
Mm-hmm.
I
Impressive.
when I arrived there, I thought, okay, when should we have ours in Egypt? When? Just when? Because okay, this is all of those people are respiratories. Imagine that. We are seven. I know the full name of all my friends, like 4 or 5 names, because we
Mm-hmm.
know we know everything about each other.
Yeah.
We're
It's
just seven.
awesome.
Yeah. So when should we have this? And we need to learn about we need to learn first, and then maybe leadership after that, and maybe building things. And I met with the ICRC for the first time, with Dan
Mm-hmm.
Rowley, the president, and
Yep.
everyone there. And I was impressed by the similar stories for every country in the world, because we have 34 countries in the ICRC.
Mm-hmm.
Imagine everyone has its own struggle, they have their own way, their own autonomy, and everything. However, we did have one thing in common, which is go RTs, just
Yep.
we advocate for this. We love this profession. I love this profession. And this profession helps a lot of people. This is because we are the people who see it. We know that we are helping those people. Maybe they just don't see because it's one of the protocol. People should get into the ICU and get out of the ICU and everything is good. No one sees what respiratory does. And maybe we need to highlight this. We need to make this profession highlighted. At the COVID time, it was the hallmark of the whole ICU, because
Yeah.
we need respiratory, we need respiratory, we need respiratory. After the COVID, okay, maybe not. Maybe we need respiratory to deliver some medication or to do this and this. However, they don't see what we really does. And maybe some people appreciate, maybe some people doesn't. So okay, I went back home from the US, and I think I stayed there for like a month and a half or more.
Okay.
And I need to do this. I need to do something. I didn't know what to do, because I went home and maybe I need to talk to people. We need to learn the same way you have learned in the US or Canada, because I met people from Canada as well at
Mm-hmm.
the ARC. So we need to do the same. I don't think it's not a miracle. We need to have the curriculum and everything and the way to teach, and not just the way. Remember, we had the curriculum back there, but we didn't have the RTs. But now you have the RTs and the perspective of an RT. So
Mm-hmm.
maybe you should teach this. So I think I didn't mention that I started my master at the UK in respiratory
Yep.
medicine, and I started learning about the science behind everything. And when I went to the US after this, okay, maybe we should mix the science with the leadership, and we can do something. And
Mm-hmm.
okay,
Hang on, Moaz.
this and
Hang on. I gotta stop you just for a second. Okay.
yeah.
When you were elected into these roles, is this like when you don't show up to a meeting and you get voluntold for something? Is that kind of how this worked? Whenever you became the governor for Egypt?
you don't know how this goes. You don't know. You just don't know. But the thing is that I talked with Dan before I went home in Tennessee. The president of the ICRC. We talked, and he said, okay, maybe we could help you with this. And he said that he's gonna offer this thing to the committee they have, and maybe you're. And I just received the email. They said, okay, a lot of people knows what you're doing in Egypt, and I just figured that there's a lot of people knows what I'm doing in Egypt, and I didn't know what I'm doing in Egypt. So they just contacted me. Okay, you're the governor for Egypt, and you need to work for Egypt to do
That sounds like what happened is
and
you
develop.
weren't at a meeting and you got appointed to a position. So
It
the
sounds
rule of the thumb
Yes,
is
yes,
you always show up to meetings, no matter if you feel like you
it's
have a spot in it or not.
yeah,
Because if you have
yeah.
leadership anything like Matt, they're gonna sign you up for everything.
I, I don't know
Exactly.
Dan. I don't know Dan well, but I would guess he liked his conversation, and it's not what you know, it's who you know. And he's like,
That's right.
"Bingo! You are now the governor of Egypt.
Yes,
Enjoy."
Yeah.
yes.
Moaz, you have
Oh,
you have totally lived an entire career's worth of advancement in just a handful of years. I mean, going from 2012, 2013, where there wasn't a respiratory therapy program, to being the first cohort to go through a bachelor's program, graduating right before COVID, going through COVID, experiencing a fellowship through the AARC, now create a governor of the ICRC, like, and creating a business that is educating the future of
Mhm.
respiratory therapy and scheduling them for their place of work. I mean, what you've done in just a handful of years is insane. It's the best like dose of inspiration that we could absolutely
Mhm.
see when it comes to your idea that you talked about whenever you were going through grad school, that you reflect a whole bunch. One of my favorite leadership guys is John Maxwell. He says the greatest teacher is evaluated experience. So unless you go back and you look at what's going on, at what you've gone through and truly break that down, you don't always grow from just life
Mhm.
experience. You have to reflect. So I love that you made that a point. And for those of you that are on the video portion of this, my shirt says Revan. And Moaz, you are a Revan, because what this truly means is when you look at things from a different perspective, when you look at things in a different light, if you look at this shirt from the opposite way, it actually says never. So back 15, 20 years ago, there wasn't a respiratory therapy program. There was an idea of that would never happen here. And you have taken that idea and you have completely blown it out of the water. So I want to just give you kudos for what you have done. You are like Matt. I don't know if you know this, but
Mhm.
between you and I, we're hanging out with royalty.
We,
We are
we are
hanging out with trailblazers, because Mindy, I told you
these
a long
two
time
right in
ago.
these corners here.
I told you a long time ago that you were a trailblazer, and Moaz,
Got it.
you were right there with her. Both
You
of
got
you
it.
guys are blazing trails, and I just love what the future of respiratory therapy holds if we have more people like you. So continue to carry your loud voice, continue to advocate, continue to champion all of the different initiatives that you possibly can, because it's only going to sing praises for our profession that we love.
Yeah. So now you have what,
Yeah,
150 RTs working in Egypt? Is that correct?
yeah. No, right now, in all Egypt, we have like 50 working, 54 working,
Okay.
and I'm gonna tell the rest of the story. It has ended already. So after this, when we started Respiratory Gate Egypt, we thought that okay, and this is a company of all the the elite RTs in Egypt, the people who started this. So we started, okay, what we really need to do. We figured out it's a three phases kind of a plan. The first
Hmm.
thing, the first phase we have is the okay, we need to train people, we need to teach people, and we need to make them learn the right way. So this is when I reached out to you, Mandy. If you remember, I needed you to
I do.
create a video for. Yeah, you remember this. I love this video because if you don't know this, Matt, because I asked
Oh,
Mandy,
tell me.
okay, yeah, I need you to create a video that we are making a training program to all respiratory, and she recorded the video and then she deleted it and recorded back again because she told me, I think I need you to make it much better. So I love
Oh,
this, and I remember I took this video and I posted on the platform we have for the whole respiratory therapist. We have a WhatsApp group here in Egypt, and it has like
okay.
755 RTs.
Mhm.
And I posted this there, and I think I sent you a screenshot
You
of
did,
the
yes.
love emojis on the video,
Oh.
because okay, yeah, it was great. It was great. And I remember we had this program started, and I had it accredited from the International Education Recognition System at the ICRC, and I had it accredited. The name was a mechanical ventilation course mastery
Hmm.
training program, and it was a training program. It was a 4-day training program, and has a 1 month of training at our facility. And I remember the first batch, we were 35 personnel, 35, 50, and then we had, by now we trained more than 150 RTs. And
Wow.
the whole number, we have another program called the Fundamentals of Respiratory Care,
Hmm.
Mhm.
and the whole number is now 150 plus, and they are all trained RTs. We created a new program called the Respiratory Therapy Fellowship Program. It's a 6-month program of training in my facility, and I'm training those people. And believe me, those are the people who I should really shout out to, because I really love the fact that we have people still at the university studying and still needs, okay, we need to learn, we need to be trained, we need to love our profession. They started knowing, okay, what we really do, and they love it, and they are persistent, and I love them all. Because so shout out to all the respiratory therapists in
Yeah.
Egypt and everyone who is striving to create this profession and advocate for the profession. Maybe in a 10, 15 years here in Egypt, I don't know the numbers, but it goes up. It just keeps goes going up.
So amazing. I think and JJ couldn't have said it better. You guys are both trailblazers in a way that just makes me super proud. You know, when we start to talk about RT Sidebar champion, you're championing, you're, you're being a champion for not only respiratory therapists, but for the patients that you take care of. And that matters. I know how Mindy feels, but you're also empowering a new generation. Sometimes being a respiratory therapist is tough. It's not an easy job. It's not. And sometimes you can get yourself down. But I think that you had a dream and you wanted to fulfill that dream. And now you're influencing not only people in Egypt, you're now influencing people in the United States by
Mhm.
listening to this podcast. So I couldn't be happier to get the chance to meet you, Moaz, especially hanging out with Mindy and JJ. What's your crystal ball? If you had anything, what is it that you want for our profession? Because it's not an Egyptian profession. It's not a United States. It's an all profession.
Mhm.
What do you hope to see? And Minnie, I'm going to ask. I want to see. I want to hear what you have to say too. Like, what do you want our profession to look like? Say 10 years from now.
Okay, so thank you, Matt, for the words. I really need to see this profession as big as any medical profession, maybe bigger, because people just this is I don't know why, but this profession has this kind of, let's say, drawbacks. I don't know why some people are
Mm-hmm.
just saying, okay, I don't love the profession, I'm leaving it. Every profession people say, okay, maybe you just shift your career and go to
Mm-hmm.
another profession. However, in this profession, I don't know why in this profession there's a lot of people are just saying, okay, I'm gonna shift the profession. Maybe they just don't work to take the fight and say, okay, we're gonna fight for it. And maybe they don't know that eventually they are going to be the pioneers. They are going to call the pioneers of this profession one
Yes.
day. But yeah,
Mm.
it takes time. However, I think it's about patience. So what I really see this profession in 10 years, what I really want to see is, what about creating this standardized protocol to the whole globe, all RTs around the globe working the same, doing the same. Anyone in the US, anyone in Egypt, anyone in Africa. I didn't speak about Africa, but Africa is a big thing. It's a big continent. And what about helping all about those people by creating this international committee or something? The International Council is big, and we have a lot of people and different countries. If you just I would like to invite you to the next meeting at the ARC this year. Hey, you're gonna hear, all right, this all of these countries has this profession with different perspective, different autonomy, and everything.
Yeah.
In Egypt here, we do ultrasounds. At
Mhm.
first level RT do an ultrasound, lung ultrasound. We do everything. We replaced our stethoscopes with ultrasounds. We just do it.
Thank you.
We know how. Yes,
We've had this
I
discussion
know
before, right?
Yes, we have. We have.
that you need to advocate for the profession. You need,
Mhm.
if you love your profession, you can do it. You just advocate for it. Anyone who loves something, just advocate for it. I'm searching how to develop this profession. So I found the APRT. Maybe in Egypt, we can call it the AMRT, the Advanced Mendi Practitioners or something. So
There you go. I love that. I
she's the
love
one
that.
started.
Oh, that's
She's
funny.
the one who started.
I
Yeah.
do have to kind of bounce off what you said, Moab, is we need to unite as a profession across the globe, because we're all
Mhm.
out to do one thing, and that's to take care of our patients who need us in the time, where they're having a COPD exacerbation or they're in the ICU or something is going on with them. And who knows better how to take care of those patients than a respiratory therapist? So, and building
Yes,
leaders, that's
exactly.
another thing. You know, we have to remember why we got into the profession. Remember that first clinical rotation or the first day at work when you were so excited and you had that passion? We need to get back there.
Agreed.
Yes, exactly. Yes, yes. I
Well,
really, yeah.
you got me. You got me inspired today, Moaz. I just for all those RTs that are maybe a little down, maybe just not feeling great about your profession, you can get it back. You
Mhm,
can get jazzed up again. If you don't like something at work, fix it.
mhm.
If you want to be a part of a network like we are building right here, fix it. Do it. Moaz, that's where I see the crystal ball being. I believe that creating networks like this, like the AARC, like the International Council, like RT Sidebar, we bring people together and just start sharing good ideas. Here, have you tried this? Have you tried that? Like, don't hurt yourself trying to do something we've already found on. Here, do it this way because you don't want to do it this way. I think if we start doing that, healthcare in general across the globe will start to change. That we could take care of people at the very best practice. We talk about best practices all the time. That's where we need to be. Now, there might be some minor changes based on culture, geography, wherever you live, but you're always trying to get better, always trying to be better. And I think that's what keeps me motivated. That's what keeps me jazzed up. Mindy, any final thoughts? Any final questions for Moaz? Moaz, fantastic interview, by the way.
Yeah, I
Excellent
mean,
first podcast.
yeah, I mean,
Yeah,
it's an honor to know you. You're
It
blazing
is.
a trail on the other side of the world, that I've never experienced, over in Egypt. So it's amazing for you to just have that passion and drive
Mhm.
to create something that's going to better yourself as a clinician and inspire others to follow in your footsteps. So, congrats. It's an honor.
thank you very much. Thank you, Mandy. Thank you, Matt. I really, when I heard about, I met Matt at Florida. Brady introduced me to him,
Yep. Hmm.
and yeah, and when he said, you said, I know you. Yes, I know you because I'm keep searching about people who speaks about this profession.
Mhm.
So eventually you will be heard one day. So I saw you. I heard your podcast. I follow your podcast. I think since it started.
Well, my friend, it has been a pleasure. I have a couple just quick updates for all the RT Sidebar listeners out there. We do have a couple podcasts we're about ready to record this week. Mindy will be there with me, especially with JJ. We have Steve Lisi from Beyond Air. He's going to discuss nitric oxide and how nitric oxide, something that we deliver, that's an RT thing, how it's starting to expand out into other things like infectious disease and cancer research. So some really interesting stuff. I think it really empowers RTs to think outside the box. Plus, we also have Caitlin Burr and Amanda Nickel, two giants when it comes to respiratory leadership. They're going to talk about something that is near and dear to them is just don't take it personally. That to be a great leader, you can't take it personally. I cannot wait. We're going to talk to them tomorrow. We also have Mindy and I did our first webinar together with Dr. Mike and Dr. Mike. It was so much fun. We're going to do the night shift version. That'll be on April 3rd. So check out all your socials. Before we leave, we always do this. It's important. Mindy, I'm going to start with you. Tell me who your shout out is for today.
Okay, yes, Mandy DeVrives. I want to shout out to Mandy DeVrives. She is such a advocate and inspirational therapist leader for our profession. And I have followed her conference after conference after conference this last year, and even at Maryland on Friday, and she inspired everyone at the conference. She is such an amazing person. So my shout out is to Mandy.
Moaz, have you ever met Mandy? Wow, she's a firecracker.
Yes.
Yeah.
That's how we describe her.
Andy and Mendes. I met them both.
Yeah.
The M&M show we call it. That's what it is for us. I know JJ wanted to have a shout out to Saul from Midland Memorial. Just JJ was super excited to connect with you. Moaz, how about you? Who would you like to shout out to?
I would like to shout out to all the respiratory professionals here in Egypt, all the respiratory therapists working in the profession, trying to build it up. I know it's hard for them at the beginning the profession it's an infancy phase for the profession in Egypt.
Yep.
And you just keep rocking and doing what you're doing. You're doing great. Shout out to all of the respiratory and my fellows at the Air Force Specialized Hospital. Shout out to all of them.
I love that. And I want to, my shout out is to my Egyptian friends here at Vapotherm, Hamdi Samir, who you know very well, and Mahmoud Ode. You guys are doing great work, bringing great technologies to your communities. And that's what this is all about. It's all about patients, all about patients, all about patients. So for Mindy and JJ, Moaz, thank you so much for being on RT Sidebar. We're going to do this again because I want to hear some of your crazy stories. Will we see you at AARC this year? Are you coming stateside?
I think it's Phoenix.
Phoenix, yes, it is.
Yeah, yes, I will be there.
So, Mindy, we will tackle Moaz and make sure we get another episode while we're there. So, Moaz, once again, thank you. Happy Ramadan for your month of religious celebrations. So, thank you for being on so late at night. I'm so glad you got some nourishment. We will see you very soon. And as we always do here at RT Sidebar, we must stay tuned.
Vapotherm does not practice medicine or provide medical services or advice. Any clinical recommendations provided herein are solely those of the speaker. Practitioners should refer to the full indications for use and operating instructions of any products referenced before use. Hosts and producers are paid employees or consultants of Vapotherm, and our guests are not compensated.